Hi, it's Jamie here at Dentistry On The Square. Wanted to do a short video today just to speak to you about some options that are available to our patients who are maybe wearing a partial denture because they've got some missing teeth, they're wearing a full denture because they've lost all their teeth, or if your teeth are becoming a wee bit wobbly due to gum disease or have broken down due to decay. So basically there's three main options for this. Our first option, which is our most popular option, is to get fixed teeth, and that involves placing between 4 and 6 implants in the jaw and then having a bridge made on top of them to fix in. Now this is an example of exactly what I was talking about there, where there's 6 implants and the teeth are fixed in. And the advantage of this is that it feels as much like your natural teeth as possible. We can do this in a staged approach, which takes a matter of months, but we can also do it in specific patients on the same day, where you would basically come in the morning, get your teeth taken out, place your implants and take some impressions, and then in the afternoon you come in and get the bridge fitted. Now that bridge is a temporary bridge that you wear for a number of months, normally between 4 and 6 months, and then you can come in and start doing the definitive bridge, where we can go through all the digital smile design process and get your teeth looking exactly the way you want it. So this is a great option for people that are wanting something that feels natural, and we can, in some instances, replace small bits of gum with some pink acrylic or porcelain or composite to make it more natural if you've lost some gum height as well. So it's a great option, and a lot of people choose to go for that. Our second option is very similar. It has the same aspect that you can have in, you can eat, you can chew, you can speak to your friends and socialise without worrying about your denture wobbling about, which is a main problem for people that have had dentures, especially if you've had them for a long time. And this is basically a removable option, where you've either got your 4 or 6 implants, you've got some posts or a bar on these implants, and a removable bridge that basically slides on or clips onto the bar and fixes in. So you can take it in and out at your will, but it's not going to fall out or jump about when you're eating or speaking. Now the great advantage of this is that you can take it out to clean it. So this is really popular for people that maybe had gum disease or they have difficulty cleaning around their mouth. So the advantage is it's obviously fixed in during the day, so you can eat and talk, but then when you're ready to go to bed at night or when you're up in the morning, you can pop it out, clean around the implants really thoroughly, and clean the underside of the bridge. Now, similar to the fixed option, we don't have the palate covered with these bridges, and that is really favourable for people that have maybe got a gag reflex and don't like the roof of their mouth being covered. It allows you to taste food better as well. Another great advantage of this type of bridge is because it's removable, we can bulk out little bits of the gum around the top of the denture, and that is basically for people that maybe when they take their denture out, they feel like their face collapses because they've lost some of the lip support. So that can't be done with the fixed option, because obviously you wouldn't be able to clean over the top of it, but it can be done with this removable option. So that's great if people have maybe had dentures for a long time and they've lost a bit of bone support. Third option is what we call an implant retained denture. Now this again is for people that have full dentures. We basically would place a couple of implants in sufficient bone, and they've got little buttons on the top of them that attach into the underside of the denture. These little bits can become worn over time, so they will need replaced. And the slight downside of this option is that there is, when we clip it on, there is still a little bit of movement because there's only the two implants in there, but it has the same advantage as the removable option, which can be taken out to clean it. But it's really nice and solid, and we normally use this on the lower jaw to replace a bottom denture that might have been really problematic when you're eating or speaking, jumping about, or even jumping out of your mouth completely, which can be quite embarrassing for a lot of people. So that's your sort of 3 main options for what we call full arches. it depends on what you're thinking, what you want to go ahead with, but the best thing to do is to give us a phone, come in and see one of our smile advisors. They can talk you through the different options and associated costs, and then you'll be popped in to see one of our dentists to do a full assessment, and we can work out what the best approach for you is. We can roadmap out a treatment plan before you go ahead with anything, so you're really in the know of what we're planning to do.